Hi, I'm Maria DiNardo, a law and ethics coach at Therapist Development Center. If you're a first-time viewer and looking to pass your social work or MFT licensing exam, or just interested in topics relevant to clinical social work and psychotherapy, you've come to the right place. If you like it, be sure to subscribe for updates. You can also sign up for our complete LMSW, LCSW, and MFT exam prep programs by going to our website at therapistdevelopmentcenter.com or click on our logo. On our website, you'll also find a library of ACE-approved continuing education courses to support your license renewal. My client disclosed XYZ. Is that a mandated report? This is one of the most common questions that I hear among trainees and associates who often feel anxious about mandated reporting in the earlier stages of their career. It's an incredibly important subject to know how to navigate legally and ethically in real life, and you can expect the BBS to test your knowledge on it at length. So let's start with the basics. What is a mandated reporter? All pre-licensed and licensed social workers and therapists are considered mandated reporters. This means that we're legally obligated to report abuse, neglect, and danger to others that we observe or reasonably suspect while in our professional capacity. In other words, when we're on the clock. Reasonable suspicion is a common phrase in our field that you'll frequently hear while studying for the exam. It basically means if another therapist with similar experience and training heard the same client information and would reasonably suspect abuse or neglect, then so would you. The three main categories under the overarching umbrella of mandated reporting are child abuse and neglect, dependent and elder abuse and neglect, and danger to others. When you take the California Law and Ethics Exam, mandated reporting will likely show up in a variety of ways. You could be tested on the following: informed consent, child abuse and neglect, consensual sex between minors, dependent or elder abuse and neglect, danger to others. That includes TERASOF, duty to protect, and duty to report. Various subcategories of abuse and neglect, for instance, isolation or financial abuse. Common physical or behavioral indicators of abuse, exploitation, and neglect. You could also be tested on timeline and sequential steps of mandated reporting, assessing versus investigating, and reporting while in your professional capacity versus outside professional settings. Now let's see how you do with a free MFT Law and Ethics exam question. Mandated reporting practice question. In an individual therapy session, a client tells their therapist that their sister-in-law recently relapsed with alcohol. According to the client, the sister-in-law, quote-unquote, passed out drunk last week while working as a solo daycare provider in her home in Washington. The children present were between the ages of 1 to 11 years. The client witnessed the incident during a family visit out of state. When the client confronted her sister-in-law, she could, quote-unquote, smell the alcohol on her, even though she denied it. The client maintains that the sister-in-law is still abusing alcohol. Considering legal responsibilities, the therapist, A, must investigate details further and process the incident with the client. B, must report suspected child neglect to Washington CPS immediately. C, must maintain confidentiality and encourage the client to call local authorities. D, must report suspected child neglect to California CPS immediately. The correct answer is D, must report suspected child neglect to California CPS immediately. As mandated reporters, we are legally required to report reasonable suspicion of child neglect while working, even when the incident doesn't involve our client. The CPS phone report must be made immediately, followed by a written report within 36 hours. We can eliminate answer A because it's not our job to investigate and we have enough details to warrant suspicion of neglect. Remember, minors do not need to be harmed to make a neglect report, nor does the incident need to occur within California state lines. However, As California pre-licensed or licensed therapists, we would make the report with California's CPS, not Washington, which makes answer B wrong. And finally, answer C is not correct because child neglect is an exception to confidentiality, and the responsibility to report here should not be on the client. Thanks so much for listening. Remember, if you're studying for your exam and looking for the best LMSW, LCSW, or MFT exam prep program, please visit our website at therapistdevelopmentcenter.com to sign up. With a 95% pass rate, we offer the best study system on the market to help you pass your exam with confidence. Here at TDC, we're with you until you pass.